HOMOEO GURU. Please subscribe my channel. Press bell icon to get continuous updates about new videos. Exam oriented video part 54. MCQs. The best marker for hyperthyroidism. T3, T4, TSH, calcitonin. Correct answer is TSH. Most common viral infection in kidney. Epstein-Barr virus, cytomegalovirus, hepatitis B virus, herpes simplex virus. Answer: cytomegalovirus. In early months of pregnancy, can lie comfortably only in stomach. Pulsatilla, acetic acid, plumbum platinum. Answer: acetic acid. Tumor secreting placental alkaline phosphatase is carcinoid tumor, granulosa cell tumor, dysderminoma, and all of the above. Answer: dysderminoma. True pelvis is also known as android pelvis, platypelloid pelvis, gynecoid pelvis, anthropoid pelvis. Answer: gynecoid pelvis. Commonest cause of death in a patient with primary amyloidosis: renal failure, cardiac involvement, respiratory failure, none of these. Answer: cardiac involvement. One of the best remedy with is to begin the treatment of a chronic case. Calcarea carb, sulfur, pulsatilla, all of the above. Answer: all of the above. Which potency has been introduced by Dr. Hahnemann in 6th edition of Organon? Cm, 10m, 50 millismol potency. Answer: 50 millismol potency. Delirium alternating with colic: podophyllum, plumbum metallicum, hyoscyamus, belladonna. Answer: plumbum met. First metacarpal joint is hinge joint, saddle joint, ellipsoid joint, ball and socket joint. Answer: saddle joint. Thank you.